We're back on Live at 9. Now, here's Kanji.
The following portion of Live at 9 is sponsored by Crestwin Behavioral Health, and today we're talking about the impact of behavioral health and dementia with aging seniors. Joining us now is Pretoria Griffin. Thank you so much for coming.
Yeah, glad to be here.
So, okay, let's talk about what are some of the signs that mental health issues in older adults are being overlooked or misattributed to just normal aging?
Yeah, so here's the thing. There's a direct reflection of a lot of mental health symptoms that correlate to just natural aging, right? So it can get really confusing. So things like memory loss, irritability, loneliness, maybe the senior isn't doing as many household chores anymore, or even hygiene. People will often say, oh, that's just mom and dad getting older. But that's also a direct correlation to mental health disorders like major depressive disease.
Wow. And so how does caring for someone with these different conditions impact caregivers emotionally, physically, socially?
Yeah, so here's the thing. I read a really interesting article a few weeks back that said by 2030, 1 in every 6 people in the world is going to be over the age of 60.
Yeah, everybody's living longer.
Right. So incredible. We're living longer, healthier, better lives. But the thing about that is, as people start to get older, you'll see things like increased dementia, and you'll also see things like need for extra caregivers. And these people are often kids, spouses, and sometimes family friends. Crestwin has a variety of outpatient programs, and we treat a number of caregivers day to day. And what they report is feeling really overwhelmed, having a lot of anxiety and a lot of guilt just based around not being able to juggle it all. Our mantra is kind of caregivers need help too, caregivers need support, and Crestwin is always here.
Wow. Okay. So psychiatric care, right? Let's talk about how that can improve the quality of life and mental health outcomes with patients who have dementia.
Yeah, so when people think dementia, they think extreme confusion or forgetfulness, and they're not wrong. That is completely a thing, but there are also a lot of other symptoms that go along with that. So you have things like aggression, hallucinations, irritability, and those are really hard to maintain in the family home. So you have places like Crestwin that have safe, supportive environments. We have psychiatric care 24/7 where they can come in and truly work under a doctor for things like medication management. They get therapy, art therapy, music therapy. And the ultimate goal is to work with the family to transition the patient back into the home safely. A lot of things that people don't realize about Crestwin is that we provide 24-hour services. That means you can walk in any time of day, rain, sleet, snow, or sunshine, and receive a free, no-cost assessment. Our goal is to truly let people in, give them the resources that they need, and help as much as we can.
All right. So do you think calling or website, like which one do you think is the best?
Again, we're walk-in, so you don't need either. That's the incredible thing about it.
Right.
But you're always open to be able to call or visit the website.
All right. Thank you for helping us parse this and understand what's going on in our homes here across the greater Memphis area. Thank you so much, Pretoria.
Yeah, you're so welcome.
Yes, good information. And the preceding portion of Live at 9 is sponsored by Crestwin Behavioral Health. Our next guest aims to help others open a whole new world of creativity right at their fingertips, literally. Coming up next, how you can join this global effort to knit people into our communities. That's knitting them together. We'll be right back.